Good afternoon, everyone. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone and require an operator assistance during the call, please press *0. For those online that require assistance, please use the chat box on your screen. I would like to now hand the meeting over to your host, Tanya McDonald, Program Director at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Thank you. Hello and welcome everyone to our 6th webinar in our webinar series, Next Steps in COVID-19 Response in Long-Term Care and Retirement Homes. In today's webinar, we will feature 2 very distinct presentations. So one focused on the reintegration of essential care partners into healthcare facilities, specifically also with a focus on long-term care and retirement homes. In collaboration with colleagues at CFHI and their Essential Together program, as well as a presentation focused on vaccine information and resources led by a medical advisor for the Public Health Agency of Canada. I will be moderating the session from my home office in Ottawa, Ontario. I would like to acknowledge that my home office in Ottawa is on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. Like always, we are pleased to host our webinars in both English and French. The telephone number to connect to the French audio is on the screen, and we invite you to use either official language when entering your questions in the chat box. So just going back to the foundations of this program, the Long-Term Care Plus program was built upon a report that was published in July entitled Reimagining Care for Older Adults. So this LTC Plus program and webinar series are based on the findings in that report, which were developed based on over 40 interviews with family partners in care, healthcare leaders, and policymakers in the spring of 2020, just following the first wave of the pandemic. It focuses on promising practices in 6 key areas that have the potential to reduce the risk of future COVID-19 outbreaks or mitigate their effects, including preparation, prevention, people in the workforce, pandemic response and surge capacity, planning for COVID-19 and non-COVID care, and the presence of family. We are pleased to offer this program in partnership with many partners working diligently across the country, which include the Canadian Patient Safety Institute, BC Patient Safety Quality Council, the New Brunswick Association of Nursing Homes, CADIF, CMA Foundation, and Manitoba Institute for Patient Safety. So session objectives today are to share co-created policy guidance to support the reintegration of essential care partners during COVID-19 and introduce a new program entitled Essential Together, share vaccine preparedness resources from the Public Health Agency of Canada, and to share Long-Term Care Plus Acting on Pandemic Learning Together program updates and next steps. I am very pleased to present our speakers today, but before I do that, I just wanted to thank you all for joining us on this knowledge sharing journey. We know that these are difficult times for many of us across the country as cases continue to rise, and we left in December with hope for the vaccine, and we come back to January with rising cases. And so we just wanted to just thank you for your commitment to the work that you do every day in providing care for residents living in your facilities. We are truly grateful for the work that you do. So for today's webinar, I'm pleased to introduce our speakers for today. Carol Fancott leads the development, delivery, and evaluation of patient and citizen engagement strategies designed to improve the patient experience and quality of care. Carol is a healthcare professional with over 20 years experience as a clinician, educator, researcher, and healthcare leader. Also joining us is Jessie Checkley. She's a senior improvement lead with the newly amalgamated organization formed by the Canadian Foundation for Healthcare Improvement and the Canadian Patient Safety Institute. She brings 17 years of experience in leading the design, delivery, and evaluation of CFHI's pan-Canadian quality improvement initiatives, including Essential Together, or also known previously as Better Together, Bridge to Home, Call for Innovations in Palliative Care, and the Extra Executive Training Program. Jessie's background is in project management, business administration, and accounting. And in the second part of our presentation today, we will be joining Dr. Bryna Warshawski, who is a medical advisor at the Public Health Agency of Canada. She is also an adjunct assistant professor in the Department of Epidemiology and Biostatistics at Western University and a past chair of the National Advisory Committee on Immunization. So to start us off with a presentation on Essential Together, I will now turn the presentation over to my colleague, Carol Fedcott.
Thanks so much for the introduction, Tanya, and thanks for inviting us to share the work of Essential Together. And this is a new program that we have recently launched, and one I think that dovetails so nicely with one of the promising practices of long-term care plus, and that is presence of family. So I'm joining you from my home office, which is here in the west end of Toronto, the traditional territory of the Wendat, Anishinaabe, Haudenosaunee, and the Mississaugas of the Credit. And I am grateful that I am able to call this place my home. So Jesse and I are going to be sharing the work of Essential Together, and I'm just going to start us off with a bit of the background and really get into a little bit of the evidence base to why are we here in this place now. And Essential Together is a new program, as we mentioned, that is seeking to support health and care organizations across Canada. And that includes hospitals, long-term care, residential, and other congregate care settings where care is provided, either in inpatient or outpatient settings. And we're seeking to help support the safe re-entry of essential care partners so that they can be there to support their loved ones in care. So I'm going to start with just some of the foundational pieces around family presence and how it's very much rooted in a philosophy of person-centered care. And there are three fundamental elements that I want to point to as with family presence to be a person-centered practice. And the first one, which I'm sure you're quite familiar with, is that being able to differentiate between who is a visitor and who is an essential care partner. And families as caregivers who are essential care partners are, in our previous tagline of Better Together, are more than just a visitor. So visitors have an important social role, but they do not participate as active partners in care, whereas essential partners in care do provide physical, psychological, and emotional support as deemed important by the patient. And this care can be in relation to decision-making, care coordination, continuity of care, and they may be involved in care management aspects in hygiene, toileting, feeding, other ADLs, and do provide social and psychological support that enhance emotional well-being. And essential care partners may be family members, but they may also be non-relatives. They may be close friends, other caregivers, those that are designated by the residents, by the patients, and that's an important aspect of who is an essential care partner. The second sort of fundamental piece to family presence is its importance that this partnership extends beyond the direct level of care, but what it might look like at more program or organizational levels. And what we saw with the many changes at the outset of this pandemic back in March, when changes were made so rapidly, that many patients, residents, families, caregivers, they were not involved or their perspectives not sought out as these changes were happening. And that this ongoing engagement is really required for a much more balanced approach to recognize the many harms and the many risks that need to be considered when thinking about family presence. And the third element is really fundamentally family presence policies and practices recognize and acknowledge the value that families as essential care partners bring to the health system. And we know from recent reports that families and essential care partners contribute up to $66.5 billion annually of unpaid care to patients and residents in hospitals, long-term care, congregate care settings, and in home care. And the evidence is very, very clear in terms of the benefits of family presence. What we see is clearly impacts and positive impacts on physical, psychological, emotional well-being and safety of residents, of patients, where there is reductions in harm, improvements in outcomes and the care experience. And specifically in the long-term care sector, there is a lot of evidence that demonstrates how family presence positively influences quality of life of residents, quality of care received, and improved physical and psychological well-being. And in particular, as they help with care management and reduce costs, and the protection of physical and cultural safety of residents, which then reduces rates of depression and social isolation, and in many cases with residents with dementia, reduced behavioral symptoms. But not only are there the benefits to the residents and to patients with family presence, but also to the caregivers, to the staff, where there has been shown to be better staff morale and communication and the quality of information that is shared. And so all of this evidence that we have taken with respect to family presence really helped to build the first program that we did called Better Together. And Better Together started in 2015, where we were seeking to support healthcare organizations across Canada to review, to develop, and to implement new family presence policies, particularly in hospitals at the time. And when we started this work in 2015, what we found was 30% of hospitals across Canada had open family presence policies. Fast forward to January of 2020, where we redid the same study as a follow-up study and found that over 70% of hospitals had moved to open family presence, really indicating the embedding of patient-centered and patient-partnered practices, but also the recognition of the value that family caregivers were bringing to the system. And then, of course, we saw the dramatic changes happen in March, where the doors were closed. And I think what was concerning for us was the reversion back to language of visitors and the focus of visitors, and not recognizing the value of essential care partners, and also the fragility of these person-centered practices that we felt had become embedded within the system. Now, of course, at the time, back in March and in Wave 1, we were dealing with a whole host of issues, and so it was understandable the rapid changes that were made at the time. Concerns about reducing vectors of transmission, the shortages of PPE, and we know in long-term care the unavailability of PPE to begin with. But as the waves have worn on, moving from Wave 1 and now into Wave 2, the new evidence is emerging, and what we're really seeing and are being able to identify the risks and the harms that these blanket restrictions have had on residents, on patients, on families and caregivers, and on providers as well. We started to see some loosening through the fall and some of the language change actually from visitors, where you do start to see the language of essential care partners, of designated care partners, of essential visitors, lots of language to start to denote that there are certain people that we need to recognize the role that they will play in supporting their loved ones in care. But what we're finding is many organizations are struggling with the how to do this safely, to reintegrate essential care partners, and what are the necessary elements to do this. And so now this is the work of Essential Together. And as a foundation to this work, what CFHI and CPSI did through the summer was use a policy lab approach where we brought together stakeholders, including those that develop policy, those that implement policy, and those that are affected by policy, to then co-develop policy guidance that Jesse is going to speak more about. But that is what forms the basis of Essential Together, to be able to support the implementation of this guidance to safely reintegrate essential care partners. And so while many of the policy lab participants were largely from the hospital sector, the evidence, the research, and the insights that were drawn on to establish this guidance are applicable to all settings, including long-term care and congregate care settings. And the foundations of the policy guidance are similar across all settings. And so I'm going to move us into some of the evidence that has been emerging over the past few months since COVID has hit us, and really that have bearing on how do we safely do this. And one of the big questions that are always out there is, are families and caregivers vectors of transmission? If we allow them to come in, are we going to get increases in transmission within our organizations? And so what's interesting that's emerged from the evidence is there's consistency. The evidence about infectious disease transmission before the pandemic, during other infectious disease outbreaks, and now during COVID is really showing that it is not the family or caregivers that are notable for the spread. It's not due to the family presence. And there are similar studies that are showing that in long-term care as well. So there's no or little evidence to suggest that family presence increases the transmission of the pathogens. The study that is often referred to for long-term care comes from Verbeek and colleagues out of the Netherlands. And what they found was when they reintroduced essential care visiting partners into care, they didn't find any increases in COVID during that time. Now, of course, there were limitations to their study, the time frame being one of them, as well as other confounding factors. But it is consistent with other literature that, as I said before, pre-COVID times and other infectious disease outbreaks. But what was interesting was many researchers have found that the infections are being introduced due to other means. And there are many of them. So poor procurement, distribution, and training of the use of PPE, the lack of adherence to IPAC protocols, and other organizational factors such as resident or patient-staff ratios in healthcare and long-term care facilities. And while we know throughout this pandemic, what I've been citing has been the published literature to date. We do know that there are internal case reports coming out of healthcare facilities, long-term care facilities, where there have been cases where families, caregivers, and staff have been implicated as vectors of transmission. But again, when we go back to the literature, what has been described are all of the things that we can do to potentially decrease the transmission and to make it as safe as possible. And many of those things are embedded within the policy guidance that Jesse is going to be speaking to you about, around active screening for residents, for staff, and for their essential care partners, the sufficient PPE and the resources, the cohorting of residents together, and voluntary staff self-confinement, the proper training for IPAC, as I mentioned before, physical distancing, hand hygiene, all of these things that we know are public health measures that we need to ensure are in place to ensure the safe reentry of essential care partners. And it really is, as we are in the middle of this wave 2 now, of really thinking about the balanced approach that we're able to take of infectious disease transmission and the promotion of person-centered care. And how is it that we do it together in hearing the perspectives not only of residents, of patients, of families and caregivers, but really bringing in the staff concerns and elements as well. The other huge piece of literature that is beginning to emerge is really what have the impacts been when we've seen these blanket visitor restrictions through wave 1 and in many cases being extended into wave 2. And what we had learned from previous outbreaks through SARS in 2013 really holds true for what we're experiencing now as well, that there have been many negative outcomes for patients, families, and caregivers, including social isolation, emotional distress, and communication difficulties. And particularly those that are in medically vulnerable situations, what we're seeing are medical errors, costly non-essential care being provided, physical and or emotional harm, social isolation, and inconsistencies in care. And specifically in the long-term care sector, higher rates of loneliness, depression, mood, and behavioral issues among residents. And that really comes out of the Netherlands study, and then within Canada, a recent report coming out of BC, the visitor restrictions, which are really describing experiences of feelings of helplessness, guilt, confusion, isolation, frustration, and abandonment. And families suffer as well with increased levels of stress and anxiety. And hospital staff and other staff working in other congregate long-term care settings are noting gaps in getting the necessary information that they often will receive from essential care partners and family members, struggling to fill the roles that essential care partners actually do when they are supporting the management of care, and also increases in burnout and moral distress. And so we can see there are many, many issues that are all wrapped together in this area, and the considerations of safe reintegration that we need to have as we're moving forward. And so I'm going to move to the next slide of the foundations, really, the foundational principles of the policy guidance that we're putting out there, which are very much aligned with those same principles of person-centered practices that we just talked about. The clear differentiation of visitors and essential care partners, recognizing the value that essential care partners bring to the system and to the care of their loved ones, and that the engagement of residents, families, caregivers in developing these new policies and practices needs to be embedded. And so I'm going to hand it over to Jesse now, who's going to get into more of the details of the policy guidance and how Essential Together can help to support health and care organizations in this safe reintegration. Over to you, Jesse.
Thanks, Carol. I think really what we'd like to say about this is that the policy guidance is really focused in two key areas, the identification and preparation of essential care partners and the entry into facility. And while the Policy Lab group did discuss a third area, which was the actual caregiving, it was felt strongly that if you can't get in the door, then you're not able to provide that caregiving, which is why we focused on those. We ended up focusing on those two key areas. As you can see, there are 7 elements of guidance that fit under these two key areas. And I think, importantly, the implementation of the guidance should be based on each person's or each group's local context, and changes made to processes and policies, as well as the communication of these, need to be co-developed with residents, clients, families, caregivers, and providers in order to meet everyone's collective needs. So just moving on to our next slide, I think Carol mentioned quite well, described quite well what we've been up to up until mid-December around holding our policy lab and then the launch of the policy guidance for caregivers as essential care partners, as well as our evidence brief. And I've linked both of those into the chat box. Carol, I know that there was an ask for the Netherlands study, and you mentioned a study from BC as well. So perhaps you can add those. So on December 16th, we launched the Essential Together program, and this is really intended for 3 audiences. An audience around caregivers, so what we're doing with caregivers in order to support the implementation of Essential Together and the policy guidance, as well as what we're doing with policymakers. And where we're really focused today and what we launched was a suite of programming that would support health and care organizations who are the implementers of these policies. So as I said, the Essential Together program supports the implementation of the policy guidance in health and care settings. And it's intended for use in any setting where health and care is delivered. So that's long-term care, congregate care, primary care, hospital, inpatient, outpatient. So it really is quite broad, but we feel that the policy guidance elements really are universal in that they apply to each of those settings in different ways, but they are applicable. And so a little bit about what we're doing with caregivers quickly. We're working together with residents, clients, families, and caregivers to raise awareness and to develop resources and tools to support the reintegration of care partners. So it's a combination of public awareness as well as working with a steering group to have them identify or help us identify what tools and resources they might need. For policymakers, we're really working to influence the development in making the distinction between visitors and essential care partners, and then in raising their understanding of the value of essential care partners in the health system. And Carol spoke to that unpaid workforce earlier in the presentation. So we put together 3 pieces of around the implementers group, and the first is our call to action. So the call to action asks organizations to commit to the call to action, identifying that they value and support the role of essential care partners within their organizations, that they support those receiving care to identify an essential care partner, and that they commit to welcoming back and supporting the reintegration of essential care partners as members of the team when they can do so safely. And there's no sign-up required to commit to this call to action. To sign up means you'll receive support for implementation. So the other pieces of the programming around implementers, first we talked about the call to action. We've developed an Essential Together tool, which helps organizations to understand where they are presently and what they have in place that would support the reintegration of essential care partners. So there's a series of questions that relate to the key themes from the policy guidance, as well as those two areas that we wanted to focus on, both the identification and then the entry into facility for essential care partners. All of these materials are freely available on our website, and organizations can pick them up and use them either in conjunction with us if they'd like additional supports, or they can pick them up, have a look at them, complete them, and use them for their own purposes within their organization. What I will say is that, this is not a program that stands alone. It is very much integrated with the work that you've been doing, or that organizations have been doing with the Long-Term Care Plus programming. It supports it, and so they work together quite nicely. So you can, if your organization is interested in implementing the policy guidance, Essential Together is a great opportunity to do that with support, but it also is supported by the Long-Term Care Plus programming. Thirdly, we have our learning bundles, and so these are self-directed activities as well as curated resources and tools that are available on our website. And this is an ever-evolving set of tools and resources that we've developed and put together, and they are freely available. The next step will be some pre-recorded content that we'll do with some of the organizations that they're a little further along in their journey, and they've already done some of this work. And so they're sharing what they've learned from their experiences and what particular elements they focused on that are part of the policy guidance. And then finally, if you're interested in additional supports through peer learning or coaching, then you're welcome to register for this program. So with that, I think we'll just move on to allow you some time to ask some questions, and maybe I'll hand it back to Tanya to help us facilitate that.
So thank you, Jesse and Carol, for that great overview. While we wait to see if there's some questions that come through the chat, maybe, Carol, there's been some comments just about the variability of practices related to family presence in different settings, and I think emergency department was the one that was identified by Catherine Fries in her comments. I'm not sure if you want to comment on that, and just in terms of what you've seen, leveraging the work you've done through Better Together and the scanning you've been doing as you've built this program?
Yeah, great observation. I mean, I think we've seen this variability of family presence in all kinds of settings across. And sometimes where you really do shake your head, sometimes thinking about what is happening out there. You know, the focus, I will say, of the initial Better Together work was really focused on acute care hospitals at the time. The work of Essential Together has absolutely broadened that out to think of all of the settings where health and care are delivered, and both in inpatient settings as well as outpatients, because there's many examples of folks that are going into emergency rooms or getting day treatments or going in for day surgery, and they're not able to have their essential care partner with them. And so the hope of this program and the hope of this policy guidance is really meant to provide some consistency in practices. There are 7 elements that Jesse had showed very briefly on sort of the pre-entry and the preparation of the essential care partner in advance of them coming in with their loved one, and then once they're in, the access and being able to facilitate their entry into the facility. But it's hoping that through the policy guidance that we can start to see much more consistency of practices across. But I think, as Jesse had also pointed out, because of the variability across the country, the local context, and, you know, many provinces and territories some have moved to these, you know, they all have different colors, but gray, red, yellow, orange, you know, there's different colors in there. may dictate some variability or the level of perhaps screening that's required, or the kind of PPE that may be required at the time, or the kind of education that might be required for IPAP training. Because there's certainly instances where we have heard about of those essential care partners that can be with their loved ones, even on COVID units, and what that looks like and how different that is versus in other areas of the hospital. And so we are hoping, though, with this policy guidance, it does give some kind of consistency in terms of the key elements that people need to think about, but the foundational principles are all the same, and it starts with really being able to make that distinction between visitor and essential care partner, and recognizing the value that this person is going to have to support the care of their loved one.
Great, and so thank you for everyone who are sharing resources and links in the chat. And it's really great to see the wealth of resources that are emerging in relation to family presence and essential care partners in the healthcare sector. So there's still an opportunity for you to put your share your questions with the chat. And so while we wait for those to come in, perhaps we'll thank Jesse and Carol for this great overview of Essential Together. And we encourage you to reach out to us if you have any additional questions following the webinar, and we'll make sure that we make those connections through our Long-Term Care Plus program. And so now I will invite Dr. Bryna Warshawski, as a reminder, medical advisor at the Public Health Agency of Canada, to provide us with a bit of an overview with respect to some information and some resources related to the COVID-19 vaccine. So over to you, Dr. Warshawski.
Thank you very much for the opportunity to speak today. I just wondered, can you hear me okay? Excellent, thank you. So I'm joined today by Patricia Huntley, who's an acting manager for the Immunization Promotion and Education Department at the Public Health Agency of Canada, and she'll help me with answering some of the questions that you may have. So if I can have the next slide, please. Whoops, just one back, I think. There's one in the middle there. So the purpose of today is just to go over some of the materials that we've been developing at the Public Health Agency of Canada, both for healthcare providers and for the public in general. And these are materials that are designed to build trust and confidence and provide information for healthcare providers and for the general public. So starting with healthcare providers, we do know that they are a really important influence for people to become vaccinated. We know that for influenza vaccine, as an example, healthcare providers are one of the main sources of information. And when your healthcare provider recommends immunizations for their patients, they know that that's a reason that people are more inclined to take the vaccines. So it's also really important for us to promote information and uptake for healthcare providers, because they are one of the first audiences who will be eligible for the COVID-19 vaccine. So they'll be getting it first in terms of priority groups, and their acceptance of the vaccine will be key both for their protection but also for building confidence for their patients. And we know that as much information as they can have will be very important for them to provide that information and advice to their patients, who will have lots of questions with regard to choices they'll have about vaccines. And we know right now, depending on the surveys we use, about 38% of healthcare providers indicate that they would get vaccinated right away, and another 39% would wait. So it's important for us to get really good, solid evidence out to healthcare providers so that they can make their own informed decisions, but also so they can help inform the decisions of their patients, who will be coming to them with lots of questions about the vaccines, which are, as we know, new and use new and different technologies. And so lots of information will help patients make informed decisions. If I can have the next slide, please. So the next slide talks about the information that we have been preparing for, particularly for healthcare providers. And just to start out with, there is a program called EPIC, which is the Education Program for Immunization Competencies, and this is developed by the Canadian Pediatric Society. This is a series of modules that have been in development or have been in existence for a while that go through the very detailed fundamentals of immunizations and provide details about vaccines and immunology. And those are been made available free through your province and territory. So those modules, if you're interested in a very detailed overview of immunization, can be accessed by contacting your provincial territorial representatives who can get you access to these free modules. They're also working on the development of a COVID-19 specific module, and that's expected to be available in February. The next thing that we've been working on is a series of webinars, and there's a number of them, and I'll go through them in a bit more detail when we get to one of the slides near the end. But we've had a lot of uptake on these webinars, which go through sort of the foundations of how vaccines are approved, how decisions are made on recommending vaccines, and then specifics about the COVID-19 vaccines that are available or that may be available. And so these are posted on a number of websites, and I'll provide you the links at the end, and are a very good source of starting your information journey if you're yet to begin that on COVID-19 vaccines. Also, we know that the manufacturers of the currently available vaccines, the Pfizer-BioNTech vaccine and the Moderna vaccine, they have been developing very useful webinars which are posted on their websites as well, and I'll provide some links to that. And as well, there's a group called CanVax, and they have on their website a repository of a number of very good resources, and the link is provided there as well. So the additional thing that we're developing at the Public Health Agency of Canada is a toolkit for healthcare providers. And so this is going to contain a number of resources, some of which are already developed and some of which are in development, including fact sheets, infographics, question and answers, and videos, and communication tips and vaccine confidence guides, all the things that you'll need to discuss vaccines and promote vaccines among clients and residents and patients. This toolkit is going to be distributed through medical societies or professional groups, and also through public health associations by email, and we're hoping to get this ready by the end of January. It will be an evergreen toolkit as it will be updated as new information becomes available, and the basis for it is a survey that we sent to healthcare providers that looks for their information needs, and we did get responses from over 14,000 healthcare providers, so this will provide the basis for both the development and the ongoing evergreening of this toolkit. The next slide speaks to the materials that we're developing for the public in general. So the focus here will be on getting facts and answers to questions from experts to build confidence and trust as people are going over the information available to them to decide on the vaccines that will be available. And we're looking particularly also to segment the information to particular groups such as Indigenous communities, ethnic groups, and healthcare provider audiences. This will be accompanied by a vaccine explainer video which is informed by behavioral science information that will explain the vaccines, including going over how they're developed, how they're approved, how they're distributed, and how they're monitored, all aimed with providing detailed information so that the public understands the rigor and safety that goes into authorizing vaccines and monitoring them for safety so that they can feel confident in the decisions that they're going to make with regard to the vaccines as they become available to the various groups. There will be videos, fact sheets, and infographics on COVID-19 that will be available in order to provide really good, solid information and to counter misinformation. There'll also be a social media presence, and we'll be working with both our existing partners and new partners to ensure that this vaccine information is targeted appropriately and disseminated as broadly as possible. There's also a planned childhood immunization campaign, and we'll be building on that campaign, which is scheduled for January to March, in order to leverage some of the COVID-19 information and confidence in vaccines. And also targeting our advertising promotion to the groups that will become eligible, because we know the vaccines are being ruled out to groups in specific sequences, and our advertising campaigns will be targeted to the groups that are eligible at the particular time. And we'll also be reinforcing the message that public health measures need to continue. I think this is really important with regard to vaccines. Vaccines are a very important tool in our toolkit to control this outbreak, but they're not the only tool, and it's going to be very important as people get vaccinated to not think that all of a sudden they can stop wearing their masks and get together with large groups of people. These measures are going to need to continue despite vaccination for a considerable period of time until we see the outbreak come under control, and then public health measures will be modified depending on the control of the outbreak, to which vaccines will contribute to the control, but it's really the control of the outbreak that will define when these measures can be modified, and your public health officials will be notifying people of the changes. But until that time, really important to emphasize the need for ongoing control measures. So that will be all part of the advertising and promotional materials designed for the public. So on the next slide, I'll just go through some of the materials that are already available so you can see, and this slide will be, have all the hyperlinks to some of them. So our website at the Public Health Agency of Canada has a place that you can click to get information on the mRNA vaccines. We know those are the current technologies that are available, so good information there to describe those technologies. The National Advisory Committee on Immunization, as you know, is the group that sets the recommendations for vaccines in Canada. So after vaccines are authorized by our regulators at Health Canada, the National Advisory Committee is a group of experts that looks at these vaccines and says, okay, what groups should be getting these vaccines and how it's best to use these vaccines. So their statements are available on the links on this hyperlink, and it's a really good detailed overview of how to use the vaccine. Additionally, on our website, we have a guidance document on how to plan immunization clinics. So this document goes through all the logistical issues about how to figure out how many people you need to vaccinate different groups, how to set up your clinics, what supplies you need, the communication mechanisms, monitoring the uptake, all provided there. Now, it's not specific for long-term care facilities, but it will give you a general overview of running immunization clinics. The next link is our foundational webinar. So this is a webinar that's posted that goes through the role of the regulator in authorizing vaccines, the role of the National Advisory Committee that I've just gone over, a general overview of how the vaccines that may be available to us in Canada work, and then some specific information on the two vaccines that we know are available now, the Pfizer-BioNTech vaccine and the Moderna vaccine. Additionally, the next link is to specific webinars based on the advice of the National Advisory Committee on Immunization. One is specific to the Pfizer-BioNTech vaccine and one specific to the Moderna vaccine. Additionally, as we mentioned, both manufacturers have very good information on their own websites, and the links are provided there. And we also came across some good resources for long-term care facilities in a toolkit that is put together by the Centers for Disease Control and Prevention in the United States, and we've provided some links there. And the following slide, the final slide here, just provides some information on resources that are either developed and being modified or in development. So I mentioned that we have a guidance document for immunization clinics. At the end of those documents are some sample forms that can be used for getting consent from residents, so a vaccine information sheet, vaccine consent form, and also an aftercare sheet after vaccination. Now, these were originally designed for the Pfizer vaccine because that was the first one available, but we are just revamping them so that they will cover both the Pfizer and Moderna vaccine, and these will be posted as part of our toolkit. There are also two resources that are specific to healthcare providers that go into a fair bit of detail about how the vaccine works, its efficacy, how the trials have shown its efficacy and safety, and also how to handle the vaccines, their transportation, storage, and handling requirements. So those are two additional vaccine resources that will be part of our toolkit. So I'll stop there, and this is just sort of a teaser for the information that will be available, and I know that that information is also being compiled for you. So we will be happy to answer any questions, Pat and I, if there are any at this point.
So there are a few questions for you. They've been coming in throughout. The first question from Lillian at UBC is, are there any user-friendly education materials developed for older people, residents, and families, to your knowledge, of course?
I think that toolkit from the CDC has some specific information for residents and families. And Pat, I don't know if you're aware of anything else additional to that. I'm not sure.
I mean, if she's not,
if she's not
on the
line,
line, she can put
yeah.
Perhaps if you can put it in the chat.
Into the chat box. Yeah.
Yeah.
Yeah. So I don't think that our materials are particularly there yet, but that there is some information on the Centers for Disease Control.
Perfect. Second question is from Jennifer Simon, so from Alberta Health Services. Are any materials addressing needle fear or commitment to comfort for adult groups as a piece of increasing uptake?
I do believe that there, on some of the resources that you're putting together, there is information on needle fear. As you know, a lot of the information is for vaccine pain and all that is designed for children, but there are definitely some resources for adults as well, and I believe that's being compiled for you.
Perfect. And I'm just trying to catch them all as they come in. So the next question is from Catherine Fries, just perhaps more of a comment if you want to speak to it, that there could be benefit in circulating materials, so key influencers, public groups, such as provincial senior advisory groups, seniors secretariats, national seniors councils in the provinces and territories could identify these groups just as a way to influence the public opinion around the vaccine to address the hesitancy piece.
Yeah, excellent. Thank you.
Another question from UBC, Lillian at UBC. So she's heard that residents and families gave consent without real opportunities to learn about the vaccines. So thank you for those resources. I think that will help a long way. And another question from Jennifer Simon, Alberta Health Services, is how is the public being consulted when these materials are being developed?
Yeah, that's a good question, and I'm not totally sure on the answer for the public side. I do know, as I've mentioned, for the healthcare provider side, that there was a lot of consultation and a lot of interest in our healthcare provider survey, and that's being used as the basis for this. Sorry, I can't really speak to the public side.
Perfect. And just another comment from Alberta Health Services that it's really great that these resources exist to help counter the anti-vaccination movement circulating currently. Another question from Eden Care Communities. So is there any initial information on the rate of symptoms, severity, and duration on receipt of the second inoculation for the Pfizer vaccine?
Yep, so in our, well, we don't have the information on current use, but we definitely have the information from the trial. So in one of the resources that I mentioned at the very end, there is a summary of the safety information and the side effect profile for both products, and it tells you both after first dose and after second dose, because we know that there is more side effects after the second dose, which probably means we're mounting a better immune response after the second dose. So it's a good sign in some ways, but we do know that there is more what we call reactogenicity or just general side effects after the second dose. So the numbers are in that resource. I think it's either the last resource or the second to last resource. Will contain us when we get that information publicly posted. It will contain the exact side effect profile, but that is information. A lot of it is available already in the product monographs. So if you go to the manufacturer's websites and look on the product monographs, you can see in the trials the number of side effects both after the first and second dose.
Great. Another question from Dale Sheriff from Sheriff Medical. So on the web link you provided on the mRNA vaccines, it says these vaccines can be developed faster. However, these technology advancements don't replace large-scale clinical trials needed to show that the vaccine is safe and effective. Do you feel that the trials have been done in order to verify the safety of these vaccines?
Yeah, so very good question. So these, as we've mentioned, these are new technologies. So we haven't used the mRNA technology before, although they have been under study. And they're very interesting and exciting technologies for future vaccine development. But one of their main advantages is that, as was mentioned, they can be produced a lot faster, and that's why they are the technologies out first. And yes, I definitely think that they have been studied in large numbers of people. So in the Pfizer studies, there were 30,000 people, 15,000 of which, sorry, that was the Moderna. In the Moderna studies, 30,000 people, 15,000 which got the active vaccine. And in the Pfizer studies, I think it's 44,000 participants, half of those who got the active vaccine. So we know that from a short-term perspective, the vaccines are performing very well and are very safe. What needs to be ongoingly monitored, both for efficacy or how well they work, And for the safety is obviously over the long run. There's no reason to suspect any safety concerns over the long run, but they've only been used for, about half of the people have been monitored in those studies for about 2 months. So we don't know longer than that time period. So that is ongoing study. But at this point, there's no indications of safety concerns other than we've seen some allergic reactions to these vaccines. And so then the usual precautions when giving vaccine in terms of having people who are trained in managing allergic reactions, having your epinephrine available, having all your toolkits available. So when you're planning your immunization clinics, being sure that that part of it was well managed. It's not a big concern. It's just something that we know we can manage those. We just know that those have been noted with those vaccines. So important to make sure that the resources for managing anaphylaxis and the training are available.
So the next question is related to administrators' reactions when staff decline vaccines. So I'm not sure if you'll have an answer to that question. However, we are going to take on that subject in our February 8th webinar, but I don't know if you have any comments around if there's policies that you know of in place when staff refuse to be vaccinated.
Yeah, so as we know, the vaccines are not mandatory. The vaccines are a choice. And so I think it's really important to try to speak to people like, what is the concern? What can we do to address the concern? How can we help you? Make an informed decision. Having all these resources available will definitely help. Your local health unit may also be able to help because they may be able to provide some information and counseling as another resource. To me, these vaccines are like a gift, like we're being offered this opportunity to protect ourselves and the residents. And so how to convey that information in a way that lets people feel confident and informed about their decisions, I think will be really important. So really, sitting down, providing information, trying to figure out what the reservations are and addressing those. But in the end, it is a personal choice. I think people working in homes so have to recognize that it's their choice, but it also impacts the residents who themselves will be vaccinated, which is added protection. But we know that the staff can be a route of introduction into the facility, and as much protection as we can offer both the residents from their own protection, but the staff from preventing that introduction is important. So although it's personal choice, there's also an impact or an implication within the facilities.
So just, we have 2 questions that came in around the delaying of the dose, so I'll try to synthesize into one so that we can finish up on time. So there are some provinces who are delaying that second dose, and there's some questions specifically related to, is it okay to delay? What are the impacts? Is this undermining the vaccine rollout that's underway across the country? If you can comment on that.
Yeah, so very good questions. So we know that one dose alone, from the trials, we know that if you wait more than, we know no vaccine is going to work in the first 14 days that you give it, but there are some really good evidence from the trials that beyond that 14 days, once the vaccine protection has kicked in, that even one dose appears to offer really good protection, as high as 90%. So what we don't, 92%, which is really close to the protection that we're getting from the 2 doses, which is 95%. So we know the 1 dose offering 92% protection, the 2 dose 95%, so almost exactly the same. What we don't know about the 1 dose is how long that protection lasts, because we know that almost in the trials, everybody gets a second dose, almost everybody gets a second dose. So I think if you're doing a 1 dose strategy, which isn't 1 dose, everybody's going to get 2 doses. You're just delaying that second dose or extending the period between the first dose and the second dose. What's really important there is to monitor those people who have still only had the 1 dose to make sure that they are maintaining that very good protection. And if we're noticing that as time goes by and they still haven't had their second dose, that they're not maintaining that good protection, then that's the time to offer the second dose. Now, generally, we're recommending the second dose within 42 days of the first dose, but we know that there are some provinces that are extending that interval, and as long as that's being carefully monitored, then that should be a safe option, assuming that that protection from the first dose lasts until that second dose. And right now, as we said, we know there's good protection with the first dose. What remains to be determined is just how long that lasts.
Great. Thank you very much, Dr. Wachowski, for presenting on the resources today and answering all the questions. As you know, this has generated a lot of questions from our group today, so thank you very much.
Yeah, my pleasure.
And we will definitely send any more along your way as they come through. So just as a wrap-up, we'll go back to the presentation and we'll just actually share with you that we are compiling these resources for you, and they will be shared via a web page on our website. So over the past couple of weeks, colleagues and I, we've been collecting resources related to assist homes prepare for vaccine rollout across the country. And so the webpage that we have developed will, it's a centralized webpage of existing information and resources that exist from a variety of different resources, including obviously those from the Public Health Agency of Canada, the Government of Canada, Solutions for Kids in Pain, and other immunization experts across the country. So the vaccine preparedness resource page is not meant to be exhaustive. However, it is intended to complement existing provincial, territorial, and jurisdiction information that already exists out there. You will see on the webpage that there is a link to all the provincial and territorial COVID-19 websites for you as a reference, and also for you to see what's happening across the country. In addition to the provincial and territorial specific information, the resource page will also be divided into 4 main categories. So Section 1 and 2 will include planning guidance, resources for immunization clinics for COVID-19 vaccines and characteristics, including handling, administration of both the Pfizer and the BioNTech COVID-19 vaccines. In Section 3 and 4, there's information really specific for providers that they can use to encourage COVID-19 vaccine uptake, including resources to guide discussions with vaccines for residents, staff, essential care partners, really with a focus on safety and effectiveness, and information to help improve the vaccine experience, specifically those where there may be some hesitancy related to pain, anxiety, and fear of needles, which we've saw is a concern, as we saw there's a question that came through via the chat. We have plans to regularly update the webpage to include new information and resources as we find them, and also to meet the needs and requests of the different long-term care facilities that are working with us in this LTC Plus program. So if you have any resources that I see many of you have already shared resources, so please continue to share, and we will keep adding to our resource page, and also let us know if there's any gaps that you see so we can potentially facilitate finding or adding to those resources. Just to note that the resources in Section 1, 2, and 4 are all available in both official languages, so English and French. And however, there are some in Section 3 that have not been translated yet, so we're working diligently to make that happen. And if you have any other needs in terms of language or adaptations, please send us an email to our Long-Term Care Plus email address. On February 8th, we will be hosting a webinar entirely focused on the early experience with vaccine rollout in long-term care. However, just as a bit of a teaser to show what type of resources will be featured both on the webpage and in upcoming webinars, there is a resource that's been developed by Dr. Anna Taddeo and colleagues, a professor of pharmacy at the University of Toronto, Senior Associate Scientist at the Hospital for Sick Children, and Assistant Scientific Staff at Mount Sinai Hospital. And it's an infographic that contains recommendations to reduce pain of vaccination in adults and different strategies that can be used. And the other example, which may be of particular interest to our long-term care facilities, is a resource that was developed by Dr. Thomas Hadjivis Ropolis, so apologies for that, who has developed a resource with a focus on improving the experience for adults with cognitive impairment with the vaccination process. So in terms of next steps, well, our program, LTC Plus program, continues to offer both learning series, the national huddles, as well as accepting registrations into the program for access to seed funding and coaching to implement your improvement efforts. So continue to engage with your family partners and residents, complete the self-assessment, and join our community of facilities across the country who are strengthening their pandemic preparedness. We have 351 submitted applications, so teams who are working with us from an improvement perspective across the country, and we continue to grow that. We continue to hope to grow this community throughout the year as we continue to share knowledge and expertise and support your improvement initiatives across the country. So mark your calendars. The next huddle is January 21st, where we'll focus on palliative care, and our next virtual learning series is February 8th, where we will highlight the experience of 2 organizations who have rolled out the COVID vaccine in their long-term care facilities for residents, staff, and essential care partners. So any questions, please send to our email address, and thank you very much for joining us today. We look forward to seeing you in the coming weeks.